welcome to another episode of the Health Notebook. Today we're at the Genesis Wellness Center, where we have met Mr. Collop, who is a physiotherapist, and we will be joining him at his practice today. And he'll be giving us some practical tips in terms of ergonomics, in terms of how to lift up a box, how to sit at a workstation as well. So Mr. Collop, it's been a great pleasure for me to have you on the show once again.
Thank you, Doctor.
So we are at your practice today, and I know you have explained to the viewers previously about the practice that you actually built up over the course of the 5-6 years. Now, I know today's topic has to do with ergonomics and lifting up items. Now, in terms of lifting up items, what are some of the practical tips that you can maybe give viewers, or what are the risks associated with lifting up an item incorrectly?
So today we're going to talk about ergonomics. Ergonomics is just, we're going to show you the correct methods of how to lift up things, and the most important thing is it's how to protect your back and how to keep a correct posture.
Okay. Now, in terms of protecting the back, I know if you actually pick up something incorrectly, from the medical side, I mean, I can list a number of injuries, and for example, you can fracture one of the vertebrae in your body, you can fall over, and that can lead to secondary complications as well. Then there's also nerve damage. Now, yes. in terms of the rehabilitative process, from the physiotherapy side, can you just highlight the road to recovery? So prevention is better to cure. Prevention is better than the cure. So if you can just explain to the viewers why is it important to take preventative measures, and just give them an insight in terms of the road to recovery if you do sustain one of those injuries.
The road to recovery, if dealt with correctly from the beginning, can be a very short one, but in most cases there's lots of things that are overlooked. People take too long to seek advice or help, or they ignore the pain for too long, and then the recovery becomes long. Then we're talking about months or even years of recovery.
If you can just explain some of the sort of the processes involved in a back injury, for example. I know we're taking back injury as a subset, but there are these common themes or factors that are involved in terms of injury. Can you maybe just highlight a few of them so that you can inform the viewers?
Yes. So there are many different causes and mechanisms of how they can injure the back. So one is a repetitive strain. So repetitive strain is when you're doing something incorrectly for numerous occasions. So that is normally if somebody has to lift boxes at work or lift the washing at home and they do it incorrectly. So over time, the injury, you get extra wear and tear on the structures in the back, and then that's when it can become damage and hurt. So you get your repetitive strain injury. You also get the awkward positioning where the technique of lifting is just incorrect, and when you do it, your load in your back cannot handle it, and that's where people sometimes get what they call in layman's terms the slip disc, which is your disc herniation. It causes a nerve root impingement in your back. It can cause the pain that goes down your leg. You also just have heavy lifting, when people actually attempt to lift an object that is just too heavy for them to physically deal with, or their body is not conditioned to lift that heavy weight. And then the number one cause of neck and back pain, in my experience, is sitting. They say sitting is the new smoking because it's bad for your health. Yeah. So sitting, if you sit in incorrect postures or incorrect positions, you actually damage certain levels in your back. And we will show you examples of how that occurs, and we will also show you how to correct your sitting posture.
Okay, so just to run it by the viewers, we'll be looking at a number of aspects today. So the first is the correct way to sit in front of a workstation.
Yes.
Then in terms of lifting up items, we'll be taking something practical like a washing basket. And then thirdly, in terms of lifting items from the floor, simple items. So you'll be giving them some advice in terms of the correct posture. So this advice is crucial, because what you're actually doing is, by you showing them the correct methodology, you actually then preventing, or if they take those preventative steps, and if they are able to sort of visualize what they're doing is wrong, you're actually preventing them from developing an injury later on during the course of their life.
Yes, we're decreasing the risk of the injury, and by doing that also, it's a cost-saving mechanism, because the rehabilitation process can be quite costly, and we're trying to prevent you from having unnecessary surgeries or anything like that. So it's important to follow these steps to prevent injuries.
Okay, so let's take a walk through to the area where you will be demonstrating to us today. As you've mentioned, you'll be showing us the incorrect way of sitting, and then you'll actually show us the correct way afterwards. So now we're at the workstation. So if you could kindly demonstrate to the viewers now and just inform them exactly what is going on here in terms of what is wrong here in this particular picture that we're seeing at the moment.
Okay. Most of my patients with neck pain and back pain are admin clerk workers, and they're working at the workstation.
Okay.
And when you speak to them, this is the position that they normally sit in.
Okay.
They're sitting to the front of the seat.
Okay.
They're sitting far away from the actual desk. Their back is rounded and curved, and when they look up to the desk, they have a fold in their neck over here. So that means that the whole head is pivoting on this axis, right on this spot here. And if you sit like this day in, day out, that is also one of the repetitive strain injuries that you do, because you're sitting incorrectly in this incorrect posture whole day, every day, and for too long.
Okay, so if you could also just explain to the viewers, okay, now she's typing as well in terms of the wrist as well.
Yes, and then there's also a carpal tunnel overuse syndrome that you can get, and that is just because of the positioning of the wrist. You know, sometimes it's overextended, it's too down, so they have to reach over onto the keyboard, so you get lots of repetitive strain in here. Or sometimes the chair is a bit too high and they're not there, and they actually have to sit like this and they type, which also causes strain and stress over there.
Okay, now in terms of I'll say that now in terms of what can go wrong. Now, what you've mentioned, just to highlight to the viewers, it's your upper back pain, it's your neck pain, and then it's also your lower back pain, and then also in terms of your wrist, which you've mentioned, the carpal tunnel syndrome. If you could just explain to the viewers as well about these muscles over here, the trapezius muscles, and what can go wrong there as well, that can maybe give them some shoulder pain as well.
Yes. So you can get increased tension in your trapezius muscles, especially if the seat is not positioned properly and you want to type. Then you lift your shoulders up, and then you're using these muscles, so they're working overtime. They're contracting, and they will get tired and fatigued, and that will also cause pain in your neck. It can cause a stiff neck and pain in your shoulder. And when your shoulders are rounded like that as well, you can also run the risk of getting shoulder impingement in front, or just too much stress in your AC joint, which is on the tip of your shoulder.
Okay, now that is just in terms of your upper limb. So let's just move a little bit down towards the lower limb as well, and if you could just highlight to the viewers some of the injuries that can occur as a result of abnormal sitting positions.
Yes, when you sit on the edge of the chair like this, there's too much weight just at the bottom of the buttock, and that is where your sciatic nerve runs through. So if you sit too long on the edge of a chair, you get pressure over there, and the pressure is on the nerve, and that is when you can get the pins and needles, or you feel that the leg is going numb or a little bit dead in there. You can also have just too much weight just going through in the hip at the wrong angle, but mostly it's mostly the nerve gets affected and your gluteal muscles.
Okay. Can you kindly demonstrate to the viewers now the correct seating approach when sitting in front of a workstation? So let's deal firstly with the chair, and then afterwards we can move towards the computer screen and the positioning of the keyboard and the mouse and things like that. So firstly, what is an ideal chair before we actually show the viewers how to position themselves?
Okay, the features of an ideal chair is that it has to at least have a little bit of a high back. Okay. And it should be adjustable. It should be height adjustable as well, and ideally just arm rests as well for you to rest your arms.
Okay.
Yeah.
Now, in terms of the base as well, should it be swivel? Should it be a fixed base?
It's ideally if it could be swivel, for you to then move your whole body. So if you need to reach a certain part of the desk, then you don't rotate just on your back, you can actually move the whole chair. So the swivel chairs works well especially if you need to access other parts of your desk as well.
Now we're going a little bit towards the feet. If you can also just show the viewers that it should be flat on the ground, it shouldn't be raised. And
yes.
So if you can maybe just lift it up so we know it's, say that is the incorrect position.
Okay, so the incorrect position is if your feet is down like that and you're putting all your weight through your toes. You do risk injuring your toes and your feet will be tired and some plantar fasciitis as well. So the best position to be is flat on the ground. So we call it the rule of 90 degrees. So your feet must be at a 90-degree angle at your ankle and your feet flat on the ground. Okay. I'm going to position her further back in the chair. You have to sit as far back as possible into the chair so that your hip with your thorax can make a 90 degree as well, and then the angle at the knee will also be a 90 degree. So it's the rule of 90s. 90 at the ankle, 90 at the knee, 90 at the hip.
Okay, now in terms of the visual display, can you also maybe give the viewers some tips in terms of visual display and the height of the screen?
Okay, so in order for you to determine the height of the screen, one of the important things is you need to sit as far back as possible. Lots of people buy an expensive chair, but they do not use the backrest. Their backs are never touching the back support. So it's important that their back touch the back support. So once you're sitting in the correct position, you need to adjust your screen so that your screen is at least at eye level, so that you can keep your neck in a neutral position and still see the screen, and not having to look up or tilt your head too down to look. The problem is when people work with laptops, it's normally very low down on the desk and they're having to look down at the laptops. Okay. So we suggest you put it on a few books or on a tray where you can
just some
raise
practical way, instead of going to buy an expensive laptop raiser, is maybe just to put it on a, as you mentioned, some books or an item to lift it up.
Yes.
Okay.
Yeah. So it's important as well to prevent injuries to take pause breaks during your day. A pause break is just when you take a break of the activity you're doing, just to do a few exercises, just to get out of that position that you were sitting in the whole
And
time.
what would be some of those basic exercises that you do just as a 5-minute short break after spending at least 45 minutes in front of the computer?
Okay, so I'm going to start at the bottom.
Okay.
So the first thing you can do is just do a little bit of feet pumps. So all you're going to do, you pump your foot up and down. Yeah. So you can get the calf muscles working. It just improves a little bit of the blood flow. But the best way is also just to stand up from your workstation. Okay? It's not always possible, but while you're sitting there, you can do a little bit of exercise by doing the foot pumps. Okay? The next one that you can do, that we always tell the people to do, is just to do a little bit of chin tucks. Okay? It's important just for the muscles in the front of the neck. So Melissa will just demonstrate the chin tuck. There we go, and then it's out. So that's all it is. Tucking your chin in towards your chest and then releasing again. The next thing to do is just shoulder rolls. So you can roll your shoulders all the way to the back, just to get these muscles to move a little bit and prevent some stiffness in here. Okay? The next one that I do is I do cervical rotation. It also stretches your trapezius muscles. So you can just rotate towards. So you just try to look as far as you can over your shoulder and return back. It's important not to hold the stretch. You might feel dizzy after you hold the stretch. So we just take it there and then look back. And then you look forward again. Yeah. The next one, you can do some wrist rolls. So you just roll your wrist like that, just to keep it moving. Otherwise it was stuck in one position the whole time. Typing down. You can also do your finger flicks, which is important. It helps with circulation in your arm as well. Yeah. So that's just to name a few.
Okay, so I mean, what you've actually provided the viewers they can actually come up with their own little program and adapt it accordingly. So they can maybe do 2 minutes of each exercise, and combined with all this, obviously it's the visual break as well, because there's a constant screen. You're constantly looking at the screen, and also combined with that is eating junk food. I mean, it's quite common for people to be sitting in front of a computer screen and drinking some type of fizzy drink, and that then all contributes to the theme of sitting is the new smoking as well. So now we have Melissa, and she'll be demonstrating to us the correct way to lift up a item, for example, a washing basket. Melissa, thank you very much for coming on the show.
It's a pleasure.
So let's start from the basics. You have a washing basket in front of you. Can you demonstrate to the viewers exactly the correct way to pick it up to prevent back injuries and upper limb injuries as well?
Okay, so usually just the way people usually do it and where they can injure their backs.
Okay, so this is the abnormal way now?
This is the abnormal way, yeah. It's just if they bend down and instead of using their legs, they try and use all their muscles in the back and try to lift up something heavy just like that. And especially if you don't know the weight or anything of it, it can actually hurt your back quite a lot. So then picking up like that, that will be the abnormal way to do it. The correct way to do it is always to be nice and close to the object. So the best way is to do everything out of your legs and not out of your back. So one way to do it is if you kneel down like this and you first feel the weight of the object, just to feel if you can handle that, and then picking it up like that. So just to show you again that it's not coming out of my back is nice and straight, but out of my legs, the legs are working. So you first feel the weight of it, it feels okay, and then I can come up and bring it, and then I have it nice, or putting it onto the table there.
Okay, now in terms of weight, can you maybe just give the viewers some indication of the upper limits of weight, because some people would see a 30 kilogram and they'll try to act brave and try to pick it up. So just some tips in terms of weight and what are the thresholds in terms of lifting items?
So every person will be different because some people, they are active, they are strong in the upper limbs, in their core is very important, and other people not. So that's why it's important to feel that the weight first. If it's really a struggle for you that first time, then you probably won't be able to handle it. You need some help.
So Melissa, you've shown us how to lift the basket. Now in terms of carrying a large box like this, could you demonstrate firstly the abnormal way and then the correct way, and then how do you actually turn or rotate as well, if you could demonstrate that to the viewers, please?
No problem. So first, the incorrect way is, or the abnormal way is for people, they start and they just see the box and they want to carry it like that. So then your arms are stretched far over the box can also be far, and that immediately causes, when you lift it up, I can even feel my back, like some strain on my back. So the correct way to do this is rather to turn the box, so you've got a bit more control, so it's not so far, a bit more control over it, get it nice and close to the body, as close as possible, and then lifting it up. The correct way now, if I want to go to and turn, is not to turn my body with the box, because that's a lot of load on the lower back as well and the mid back. So what you need to do is you need to turn with your whole body, and turn with the feet, and then move in the different direction.
So now we're joined by Eber, who is also an employee of Genesis, and he'll be showing us exactly how to pick up small items from the floor the correct way, and then, or first the abnormal way and then the correct way. Eber, welcome to the show.
Hi, thanks Tom. Okay, so when picking up small things, what people usually think is because it's small and it's irrelevant, they can just pick it up quite quick, but that's quite wrong, and you can usually injure your back like that. So what people usually do is they just quick down, up, and you can see as my lumbar spine is there's a lot of stress on it, and it's not bending at the legs, and that puts a lot of strain, especially when we want to lift something heavy or light from the floor. So yeah, that is the way on how not to do it.
So what you've done is you've demonstrated to us the incorrect way. Could you kindly demonstrate to us the correct way, please?
Okay, so when things are on the floor, what's recommended is that either one, you bend down on both knees, or you put one knee on the floor. When you are like that, you have much more leeway. It's a shorter distance for you to work, and your back is more at a comfortable position, and more importantly, you're not putting anything on strain, therefore you won't be injuring anything.
Eber, we've reached the end of the show now, and you've actually shown the viewers quite a wide variety of ergonomic principles that can prevent injuries. So just to sum up, what are the important take-home message?
The important take-home message is to take care of your back, and prevention is better than cure. So with the main messages you need to take back is you need to know your pause exercises, really concentrate on correct postures and your lifting techniques.
So there you have it. you've heard directly from the physiotherapist. He's also demonstrated to you some of the possibilities or some of the correct procedures that you can apply when lifting up boxes and when sitting at the workstation. And we actually look forward to further engagement with Eber and here at his practice, so that we can actually show you firsthand what actually takes place at a physiotherapist center. So thank you for watching. Stay tuned for another episode, same time, same place, next week.